A key issue we noticed was the team's inability to clearly coordinate information to the patient. For example, his GP and dietitian gave conflicting advice regarding frozen meals, leaving him unsure of which to follow. He also mentions that he felt overwhelmed with all the information that he was given from the different health professionals. When messages are contradictory, combined with the sheer volume, patient compliance with professional advice becomes far less likely. On top of this, he also had to retell his story each time he visited a new health professional, which he described as quite distressing.
A part of David's care that functioned poorly was the handover between the different health professionals. This was shown in a lack of communication. For example, when David arrived at his psychology appointment, the psychologist was unaware of a referral being sent through, so had not been able to read up on David's background before seeing him. This limits the care that can be provided and also means that David has to re-explain his situation again, which will take away from the appointment time and also may cause distress to David having to recall the events. In addition to this poor communication, David is also getting contraindicating advice regarding his health. For example, his dietitian says that it's okay for him to have frozen meals, whereas his GP says no to this. This confusion will cause extra stress in David's life as he doesn't know who to listen to and will ultimately have a negative impact on his health.
In this situation, David was not involved in resolving the conflicting information he received. When the contradictory advice was given, no professional stepped in to clarify or to even explain what was the reasoning behind each recommendation. So he was left to make a choice without fully understanding what was clinically appropriate. And most of the communication happened when he followed up on his own. There was also no system update regarding the next steps, which eventually led to a missed occupational therapy appointment.
Overall, it was evident that the key area where the multidisciplinary team broke down was the communication between different team members. On numerous occasions, as illustrated earlier, it was clear that David was not shown patient-centered care through the inability of the team to coordinate and communicate effective care. Specifically, instances when David had to continually reiterate his condition and feelings to different health professionals, and the team's inability to clarify contradicting advice will be reviewed, and recommendations to fix these problems will be addressed now.
To solve the first problem, regular interprofessional meetings are crucial. This allows healthcare workers to collaboratively develop a comprehensive care plan for the patients and make sure they are on the same page when giving advice. While in terms of patient education, information should be explained in layman terms, with the teach-back technique used to confirm patient understanding. If possible, a leaflet can also be provided so that the patient has clear information to take home, which helps improving patient adherence to the care plan.
As mentioned previously, it would be recommended for the interprofessional team to have set meetings at the beginning of each week. This would include sharing information on the treatments which David has already received and clarifying when his upcoming appointments are for the week. Throughout the week, when it may not be possible to have a meeting, it would also be beneficial for the team to send emails and basic reports to track David's progress and raise any concerns when needed.
Another recommendation to try and improve communication between the health professionals is to potentially refer David to a holistic clinic where there are multiple different health professionals working within that same environment. This can make discussions and communication between the professionals more effective. Therefore, they may be able to treat David as a whole client instead of as separate little parts.
To summarize, those strategies proposed above should be effective in making sure that David's medical condition management can improve significantly. Along with that, the strategy would provide an outline for future patients who need management from multiple disciplines. By applying these strategies, every patient would experience better service from all healthcare providers, and their condition would be treated more effectively and rapidly.